Professor Kearney, you're welcome, and I'd like to ask you to give an opening statement, but to confine it to 5 minutes, please, and thank you very much.
Great, thank you, and thank you for the opportunity to speak today, and good afternoon. So I wanted to start really with outlining why we are advocating for a zero COVID island strategy with 3 reasons. So firstly, and I know you'll all already be aware of this, but I think it's important to reiterate what we know and what we don't know. So what we do know is that COVID-19 is a serious and scary disease. We heard this morning that workers in meatpacking factories are petrified about going to work. We know that it causes death and it causes disability. And so there's increasing emerging evidence about the long-term consequences, the so-called long COVID. But secondly, and importantly, we know that we can stop the virus. There is evidence from different parts of the world where suppression strategies and going on to elimination has been successful. And we know that closer to home as well. Early on, Ireland's response to COVID-19 was very effective. We saw that due to our efforts as a people, we avoided swamping our health service. We avoided the so-called surge. We worked together to suppress the curve. But the problem is that, and the challenge that we're facing now, is that more recently the policy has become one of suppression of the virus to a so-called tolerable level, this idea of living with the virus. The challenge with that is that we are now always 7 to 10 days behind the virus in our response. So while we saw that the success of the efforts that we made together with the dropping number of cases, we've seen more recently how quickly that can change. And the rising number of cases over the last few weeks, I think, has really focused the minds in terms of where we go next. And that's the third reason that we are here advocating for a zero COVID island strategy, is that we need clear and decisive action. We need our population to understand the goal that we are all working towards together and what we need to do to get there. We have seen that the Irish population can work to flatten the curve. We now need to work together to stop the curve. And so I want to explain as well what we mean by our zero COVID island strategy. We are defining this as the absence for a suitable period of time of community transmission of SARS-CoV-2. How do we get there? Well, we need leadership. We need our government to be clear that it's going to take on a policy of elimination. The types of measures that we would need to do as a population are those that we are becoming increasingly familiar with. So a strong adherence to hand hygiene and cough etiquette with regular hand washing, being really consistent with our physical distancing, the widespread use of masks, especially indoors. We need to have more active case finding, testing, tracing and better support for isolation. We are also advocating that there would be no non-essential travel into what we are calling green zones, and so an approach that we'll take within the island, which my colleague Professor Anthony Staines will describe in more detail. We're also advocating for no non-essential foreign travel, with testing, isolation and tracking the movements of incoming people at ports and airports. And the reason for this is that we will have a shared goal and work together to support the recovery of our economy and our society. And I think Professor Staines is going to give some more detail on the green zone. Thank you.